Coming to the next topic, that is atypical uterine bleeding. Before moving on to atypical uterine bleeding, we need to know about the normal menstruation. So the regularity of menstruation is now, according to new proposal, is 7 to 9 days, and duration of bleeding is up till 8 days. The old one being 2 to 8 days. So here up till 8 days, the new proposal, less than or equal to 8 days it is normal, and greater than 8 days it is prolonged. Now, the bleeding which does not follow the above normal characteristics comes under atypical uterine bleeding, and it could be due to structural lesions or non-structural lesions. Here's a mnemonic: structural lesions palm and non-structural lesions coin. In structural lesions there is a destruction of the or abnormal uterus size, and non-structural lesions it does not disrupt or disturb the size of the uterus. And the structural lesions are palm polyps, AUB-P, AUB-A for adenomyosis, AUB-L for leiomyoma, M for malignancy or hyperplasia. And coming to non-structural lesions, AUB-C is for coagulopathy. This is seen in hereditary von Willebrand disease, and ovulated is due to anovulation. It is due to anovulation or ovulatory dysfunction, and AUBE is due to endometrial causes, and AUBI it is iatrogenic, that is physician induced, such as oral contraceptive pills and intrauterine contraceptive devices, and AUBN is not otherwise classified, that is all other lesions or all other lesions that are not including any of these. And coming to identification of patients with heavy bleeding, we use a PBAC, that is a pictorial blood assessment chart. The chart is given to female with complaints of AUB. Scoring is done. Score greater than 200 indicates HMB, high menstrual bleeding, and also if hemoglobin is 10 less than 10, soakage of pad every 2 hours. Bleeding is interfering with day-to-day life, such according to ACOG criteria, that is American College of Obstetricians and Gynecologists use this criteria for high menstrual bleeding. So this is the PBAC chart where the month is mentioned and the dates, all the 15 days, and light, one patient each, 5 points each, 20 points each if there is heavy, and light. These are all the pads and tampons used, and if at all it is light wetted it is 1 point, and then medium wet 5 points each, and heavy wet 10 points each. And also cloths, 50 paise coin size 1 point each, and 1 rupee coin size 5 point each, and flooding 5 points each episode, and calculate the total score. And if at all the score is more than 200, it indicates high menstrual bleeding. Criteria for positive screen for coagulopathy: any of the following can be used, like history of heavy bleeding started menarche, any one of the following, such as postpartum hemorrhage, bleeding associated with dental work, surgery related bleeding, etc. And next, coming to clinical vignette of the AUB, based on history, we are going to see the patient comes under which AUB criteria. History of intermenstrual bleeding or metorrhagia, it is polyp or endometrial cause, it comes under AUB P. History of HMB, marked dysmenorrhea, AUB-A, adenomyosis. History of prolonged uncontrollable bleeding, fibroid, submucous. And history of heavy bleeding at menarche, family history, AUB-C, coagulopathy, von Willebrand disease. History with signs of anovulation, oligomenorrhea, signs of insulin resistance, PCOS, AUB-O, anovulation. History of copity, AUB-I, iatrogenic. And based on examination, uterus, normal in size, and uterus enlarged. So we know uterus normal in sizes in conditions polyp, coagulopathy, ovulatory disorders, endometrial, and iatrogenic. Wherever the uterus is enlarged, much enlarged and irregular in fibroid, uniformly enlarged up to 12 week sizes adenomayosis, normally to mildly enlarged, with restricted mobility AUB-M, such as in malignancy or hyperplasia. So these are the mnemonics we have already discussed previous papers. And coming to investigations recommended by Foxy or FIGO in case of AUBR, lab investigations we need to get complete CBC and UPT if pregnancy is suspected in reproductive or perimenopausal or adolescent females, and we also need to get all the times PT, bleeding time, clotting time, prothrombin, and PTT done if there is positive screening for coagulopathy, and further investigation for von Willebrand, and TSH levels and serum ferritin. Investigations are all included in this. Are investigations included in von Willebrand panel are VWF factor 8 activity and should be done before starting. And imagings are used at USG, Ultrasonogram should be done in all AUB patients, and Doppler ultrasonography on suspecting AV malformation, malignancy, and to differentiate between fibroid and adenomyosis. For intracavity lesions, the best is hysteroscopy, such as a distension media should be used before inserting hysteroscope to distend the uterine cavity, and also CIS, saline infusion sonography, MRI to differentiate between fibroid and adenomyosis, and endometrial sampling. This is the best. This is the investigation of choice for assessing endometrium. It is an OP procedure. It can be done by simple endometrial biopsy or endometrial aspiration cytology. It is the investigation of choice here. Indications for endometrial sampling are all the females according to national guidelines, females more than 40 years, and according to FIGO, females who are aged more than 45 years, and all females less than 40 years complaints of AUB and who have high risk factors for endometrial carcinoma such as obesity, hypertension, PCOS, diabetes, and AUB unresponsive to medical management. And in postmenopausal females, endometrial thickness greater than 4 millimeters on USG. And what is fractional curettage, DNC? The fractional, this is the gold standard method to assess the endometrium. It is done in OT under anesthesia. Fractional curettage is nothing but it is divided into different sections like fundus, body, isthmus, cervix, and sample is curated from each section. This is known as fractional curettage. And coming to ultrasonography findings in AUB, and this is the clinical condition. Smooth intracavity mass, this is a polyp, and with also a bridging vessel sign, as discussed, heterogeneous texture of endometrium and endometrial myometrial junction, adenomyosis, well-defined solid mass, whorled appearance, fibroid, thick endometrium greater than 12 millimeters in reproductive age, more than 4 millimeters in postmenopausal, endometrial hyperplasia or cancer. And uterus is normal in size, but fluid is there in endometrial cavity. That is due to endometrial AUBE, and thick endometrium with polycystic ovaries, AUBO, anovulation, normal uterus with normal findings, sometimes a hemorrhagic cyst, AUBC, coagulopathy. What are the different managements of AUB? Depends on cause. It depends on age of the female, depends on severity of the bleeding, that is mild, moderate, and severe. Coming to general management is severity of bleeding and management of pain. Coming to mild bleeding, normal, no hormonal treatment is needed. Reassure the patient with iron supplement, folic acid, and NSAIDs to control bleeding, and maintain a menstrual diary. Moderate bleeding, hormonal treatment with OCPC, estrogen and progesterone complex, and severe bleeding, heavy menstrual bleeding, we use dilatation and curettage and IV estrogen.